Hello and welcome to the MedHab sponsored webinar regarding long-term care of your patients. Two of the products that we will be talking about alongside with the remote patient monitoring program from Medicare is Steprite and MyNotifi. As stated, long-term care of patients through Medicare's remote patient monitoring or RPM program is the topic of today's discussion. Should last about 30 minutes. And really the bottom line is it's how to enhance revenue, and it's made easy with legislation set forth by Medicare. I'd like to introduce you today to Dr. Paul Handel. Dr. Handel is a retired Senior Vice President and Chief Medical Officer of Healthcare Service Corporation. He's also a medical advisor to MedHab. The disclaimer that we want to iterate at this point in time is that we did research on CPT codes and associated reimbursements. We did this in North Texas, so the values that we show, or the dollar amounts I should say that we show, may be slightly different in your area, and we encourage you to obviously investigate that with your carriers. With that, I'll turn over to the next slide, talk about the agenda. We've already introduced ourselves. We'll talk a little bit about telehealth, why it started, where we are, where it's going, long-term care of the patients, the most important topic here, a little bit about the technology, Steprite and MyNotifi RX, the Otago program for those of you that are not familiar with it, and of course, reimbursements that are associated with the long-term care of your patients. And then at the end, we'll talk a little bit about setting up, and then there'll be a call to action, and you can certainly ask questions send questions by way of email. Dr. Handel, I'll turn it over to you.
Great, thanks, Johnny. This turns out to be a remarkably timely topic, and what phenomenal technology for us to be bringing to you today. The telemedicine has been around for a long time, and it's gradually picked up some steam, primarily being used to meet unmet needs in rural areas and in underserved populations. It's been used by some insurance carriers in the past, albeit with elements of reluctance as people were getting used to it. And then the other piece of it was, no question that insurance companies in general didn't want to pay for long-term care of patients, particularly if they hadn't been established with a provider or a practitioner, and that it really wasn't set up for that type of a program. On the other hand, COVID-19 changed our world in more ways than we can possibly imagine. Medical offices were closed very rapidly, and those that were left open had to change how they dealt with patients. And as a result, there was a very rapid transition over to telemedicine or remote patient monitoring. And what's been fascinating is to watch how quickly offices adapted to both the technology and the need and got on the program basically on their own, learning how to do things almost in an ad hoc situation. Now, no question that paying for telemedicine prior to COVID-19 was not a good deal for most offices, but there's been a gradual transition in terms of coverage. Medicare has been leading the way in terms of how the therapies could be rendered by telemedicine. So the CARE Act and the 1135 waiver have all helped to facilitate that. And then the other piece that we've noticed is that there is expanded coverage for rehab services via telemedicine starting early last month. Have the next slide, please, Johnny. So what the opportunities have been now is to determine how do you best use telehealth or telemedicine and remote patient monitoring in clinical settings. It's been, again, another learning process in how do you get the best patient-facing technology, understanding your offices will have better technology in most cases than what you're going to be getting on the patient's side of the equation. And then you've got to figure out in your own mind who benefits from doing telemedicine, which patients are really amenable to that, and which ones should you say we need to arrange a visit somehow, somewhere. And the neat thing about the opportunities involved in keeping, or rather using telemedicine, is that you really get the opportunity to keep the patient actively engaged in the therapy services so that you can keep your long-term follow-up electronically while your patient clinic, rather the clinic patient visits are reserved for new patients or those patients that are having problems that are not amenable to telemedicine. What we've realized, and we've known for some time, is that patient contact doesn't have to be real time, but regular communication really becomes very important. And the beautiful thing about this is you can get it scheduled so it's at a convenient time for both the practice and the patients. It becomes a win-win situation for everyone. Potentially, and this is something that's impressed me for a long time now. In fact, this dates back to when Johnny and I first started down the MedHab trail, is that there is a high probability that this will enable us to transition into wellness programs that will help us monitor chronic disease states better and more efficiently. Next slide, please. So, questions come now. How do you effectively start doing remote patient monitoring in your practice? And that's going to be something we need to think about and talk about how you do that. Again, my sense of it is, and what I've experienced in a number of different practices, the technology is going to be the easy piece. What happens when the 1135 waiver goes away? Well, number one, we really don't know that it's going to go away. And my sense is, in all of the seminars I've participated in, attended, listened to, telemedicine, remote patient monitoring is not going to go away. I sense it is here. It will be part of the new way of practicing and caring for patients. The benefits of obtaining all of the patient's data is going to be readily apparent, because now you're going to be able to see how the patient is actually doing in a live situation in a home setting. You can see, is your therapy really effective? Are your patients now following directions and doing what they're supposed to be doing? And this will become a bigger issue, and this is highlighted now because as episodic payment of care expands, following the directions and determining and helping to direct the outcome for that patient is going to be absolutely essential. And then lastly, can we begin to look at and see adverse trends that are now starting to emerge in what's happening with our patients? And that we know that remote monitoring devices will become integral to patient care and to wellness practices in general. Next slide. The ideal uses. Number one, I think this is going to be a mechanism that keeps patients loyal to the practice. They're going to have a sense of being related to the people on a more frequent basis than, and you pick the interval. If you're seeing a patient once every 3 months, once every 6 months, once a year, at some point in time, you forget what your patient looks like. You may forget what their name is. You forget what's going on with them. And I guarantee you, the patients have the same issues, particularly as we're beginning to look at a more elderly population with their own memory issues. Being able to interact in a video setting with remote monitoring enables you to keep a closer contact with your patient, gives them a greater sense of your involvement in their care on an ongoing process, and allows you to have a better sense of how they're doing. In many cases, being able to pick up a problem before it becomes a crisis. You involve your staff in how they can monitor the patients to help spread the work out. Again, looking at how we get the lowest license to do the work that is available to them, allowing you to practice at the top of your license. Now, the other piece of it that we've thought about for a long time now is that this may enable physical therapists in particular to do remote care monitoring, which will allow the physical therapist to have a greater patient volume without having them come into a physical location. And again, reiterating, and this last point is, I think, important. Patient contact doesn't have to be real time. Don't usually read it verbatim, but that's important. But I'll tell you what really is important: having regular communication with your patients at times when it's convenient for them and for your practice is remarkable in terms of the therapeutic benefit. And ultimately, as I had mentioned earlier, I sense that our telemedicine, our remote patient monitoring, will indeed move into wellness programs that enable us to monitor how our patients, for instance, with arthritis or diabetes, to see how they're doing almost in a real-time basis at a more convenient interval for your office, because you can pick up disease problems earlier, but also for the patients where they don't have to make the trip in, but they get the same benefit. And the last piece of it is, again, whatever the frequency of the monitoring is ultimately going to be, whether it's monthly, every 6 months, quarterly, that it will enable the offices to pick up adverse health trends, maybe before the patient even realizes things are changing for the worse. Next slide.
Thank you, Dr. Handel. I'll take it here for a few minutes, give you a breather. As the founder of MedHab and the visionary of the products, I am fortunate to have had some incredible engineers and IT people to help with these solutions. And as you can see here by the graphical representation here, the picture, our technology works off of smart devices, and today most patients have smart devices. So what we have is our technology is patented, and it's all in the field of remote wearable technology, so that whereby you can take care of your patients while they're with you in your office, while they're at home. They're doing exercises that you have asked them to do for their wellness, as Dr. Handel said. The first product that we're talking about is Steprite. And really simple, it's just think of an insole. They're very malleable. Just think like a Dr. Scholl's insole. That's what it looks like. And all the technology is resonant within the insole. You don't even know that anything is in it. It has the capability of measuring body weight, pressure, gait, and range of motion of the lower extremities. And you as the provider can set the rehabilitative protocols from a menu of over 140 American Physical Therapy Association exercises that are approved. As well, Steprite has the Otago exercise platform that is clinically proven to mitigate falls by as much as 46%. And we'll talk about that momentarily. The other product that we'll highlight on is MyNotifi, and actually MyNotifi RX. And in its early form, MyNotifi was a retail product for fall detection. And we have morphed it, seeing where telehealth and remote patient monitoring was and where it's going, to a clinical device where we have put the Otago exercise platform in there, along with about 40 to 45 American Physical Therapy Association approved exercises as well. And we're actually adding about 28 more as we speak. And the difference is MyNotifi can actually be used on the upper or lower extremity for exercises and or movements that you might want your patient to do to help mitigate falls and keep them healthy. But it has the added benefit of fall detection. So here's a picture. I already showed you, talked about the insoles, you know, how they look. There's a picture of them, the Steprite. The armband there is the MyNotifi device. I might add that this technology, the Steprite, is a Class 2 exempt device for the FDA. MyNotifi is a Class 1 exempt device per the FDA. Both are HIPAA secured, so any data that's being transmitted from the patient to you as the provider, or with the case of MyNotifi, in the event of a fall that goes to a family caregiver, it's all secured through HIPAA, you know, our HIPAA regulations. The thing that we did, we'll talk about remote physiological monitoring here in more detail in a few moments, is that the guidelines with those indicate that you must have either heart rate measurements, oxygen saturation measurements, or weight. So our technology comes with a pulse oximeter, and the patient at the beginning and conclusion of their exercises would simply take that pulse ox reading and put that into the app, and that could be a first clue of some type of pulmonary issue that the doctor may see, both from a resting standpoint and post-exercise. And lastly, here on the bottom right, that's just how the device is shipped. You can see it comes with a, I'll put the cursor here, that's a charging device. This is an FCC Part 18 approved, which is medical device. All this is medical grade plug-in, so it doesn't, you know, resonate any electric static coming out of it, so you don't have to worry about it. If patients have heart monitors or pacemakers or anything, it's all covered. In this case here, you see this is the MyNotifi here device. If it was the Steprite device, this would be a bigger carve out and the insoles would be in there, but that's how you can see how it's shipped. As I mentioned a few moments ago, one of the added benefits of MyNotifi RX is that it is actually a fall detection device. Now, it's waterproof. It can be worn interchangeably on either wrist for fall detection, shirt chest pockets, bra, or even with the belt clip on the belt that we provide, the belt on the belt with the belt clip that we provide. So you have options, and it's efficacious in fall detection from any of those locations. However, for exercises, it needs to be worn on either wrist, or if it's a lower extremity exercise, you know, around the ankle. So here's how it works though. In the event of a fall, the device will start to pulse vibrate or tone. Okay? It will continue to tone until it is deactivated. So what the patient would do is either through the phone or on a red button on the device, they would turn it off. Very simple thing to do. Push the button or click the phone. And what happens is they are then confirming that they fell and they need help. And the device just sent that HIPAA secured message to their family of caregivers, which can be as many people and whomever they would like to be on that notification list. It goes out simultaneously. The people, the caregivers get it, and they see that that is a precaution that a fall occurred and help is needed. Now, as we know, a lot of times falls can be of much more violent nature. The patient may be incapacitated or unconscious. That's not a problem. The device will pulse vibrate for exactly 1 minute. At that point in time, it assumes that the patient is incapacitated, and it sends an escalated message now to the family of caregivers, letting them know. Now it's a warning that the patient has fallen and they have not responded or unable to respond. Now, it's not just about the fall, however. Many patients that you have may have COPD or other comorbidities that lend to them needing additional help, and that's okay. Maybe they're sitting in a chair, they can't get up, lying down, they can't get up, or just feeling lousy. They can push the button or tap the app and send a request for help immediately to their family, and the same process works. Everybody knows, and not only do they know simultaneously that help is needed, But now the family of caregivers can also see who has responded so that the coordination of care for mom and dad is taken care of. Now, these do not go to you as nurse practitioners or providers. That just goes to the family caregivers. What's transmitted to you is obviously the exercise, the data, the compliance, so you can manage them for the long-term care through the RPM program. As I said, the wearer of the device designates the partners or their caregivers, and it really can be as many as they want or as few as they want. So I wanted to put up a few sample dashboards for you. The top 3 in a row are the Steprite dashboards. As you'll see on the left, you'll see there's 2 columns here with all the numbers here. That's just the time and date stamp. That's the left foot. That's the right foot. It shows the overall symmetry bilaterally in the limbs, and it also shows within quadrants of the foot. So you can see over time, are they starting to, stand behind the ankle for some reason or on the ball of their foot? Are they supinating or pronating? All that has something to do with their, not just their posture, but maybe pain. And it could lead to discussions as you see changes in that. As well, this line graph here, hopefully what you would see is that the line graphs are pretty close together like this, meaning that they're pretty close to, symmetrical. And maybe, not all patients can achieve symmetry for many different reasons. But as long as they're on the same plane continuing, that's probably not a bad thing, depending on that patient. But if you see degradation start to occur or a widening of that, that may be an area to discuss. The middle graph is the gait analysis, and this is what you normally see in the gait analysis textbooks. The technology shows you if the patient is shuffling their feet, or are they really heel to toe striking, or are they moving from supination to pronation for forward propulsion. In this one here, it's not very clear to see this, but the dark red lines, that left foot is behaving exactly how it needs to. Nice propulsion off the pronate, the first metatarsal. Not so much down here. We have webinar or vignettes that show you how to read all that if you need any type of help. The third one here is our standard range of motion graph. In this case, it's a toe raise. You can see the wedge, the pie chart wedges. You can see the left, it's all day stamped and time stamped here, and even their compliance, number of repetitions. And the fourth one I'll show you here, this is specific to MyNotifi. And what MyNotifi looks at is, because it's not in the insole, it doesn't measure force, but it measures speed of motion in milliseconds, repetitions, and degrees of motion. And this here, it's selected on degrees of motion, and this is an active resisted extension exercise. And you can see that both arms are, move pretty similarly, not too badly, and they're tracking along, playing pretty well. The amber here is the right arm, and the blue is the left arm, and it's all day stamped. And again, if you start to see degradation in these, then obviously that's an opportunity for a productive discussion with your patient. I just blew up the one dashboard here a little bit more for you to make a point on any of the dashboards that you see here. If the patient is not compliant, and that's a big thing with the RPM program, they need to be compliant with what you're doing so they continue to meet the guidelines of RPM, but it's also important to your reimbursements. So anytime you see something in red here, that means that the patient was not able to perform their therapy. Now, it maybe, who knows, they could have had vertigo that day, they may have maybe had some pain, but if you see a consistent history they're not meeting your protocol, then that's obviously opens the door for a really nice discussion with them to see what needs to be done to better serve them and hopefully keep their strength and balance going. I'll continue on here at this point, turning it over to Dr. Handel, talk a little bit about the Otago exercise program.
Yeah, thank you, Johnny. The take home from the Otago exercise program was mentioned a short while ago. A 46% decrease in falls in patients that were put on the Otago program. And this is absolutely critical. Not only do you have the decrease in the fall rate, but the morbidity associated with it, and ultimately the mortality that goes along with it is likewise diminished. And these are critical points for us to keep in mind. Wonderful thing about it is that the programs are embedded in the devices. There are, forget the number now, Johnny, what did you say, 40 or 45 different exercises?
There are 40 currently in MyNotifi, and we're adding 28, and there are over 150 now on the Steprite platform.
Okay. So what you're hearing is there is a wonderful library and resource for exercise programs to fit almost any patient's need, irrespective of their underlying conditions, if they're into a program for either prehab, where we're hopefully preventing any type of an injury, or rehab. So I think that the critical thing here is the programs are there. They're literally and figuratively embedded in both MyNotifi and in Steprite. And the last point I'm going to make here is that the Tai Chi programs probably fit into these beautifully and are readily available on community bases across the country now. Next slide, please. Now, and again, part of what we're looking at here is this really was designed to be home-based. It could be done remotely with a physical therapist actually viewing what the results of the activities are on a regular basis. And the neat thing about this is that the studies that have been done in the United States at the University of North Carolina, and you see a website, a link here that would allow people, whether they're physical therapists or even practitioners, providers, wanting to go online and get certification through the Geriatric Education Center, enabling them to use the Otago program and begin to get the benefits of that program for their practice and, more importantly, for their patients. Johnny, do you want to add anything here?
No, I just, as you said, we put the Otago exercise program into both Steprite and MyNotifi because as we saw the market evolving to telehealth, remote patient monitoring, and of course our senior population exploding, we felt the need to put in a clinically proven exercise program to augment or supplement any other exercises that you deem appropriate for the patients that you have that you need to keep active and keep moving that are in your practice.
Thank you. Next slide, please. Okay, so what we wind up doing with Otago, Steprite, and MyNotifi is it really embellishes, enhances, strengthens the continuation of care and gets patients actively moving in a mechanism and in a way that allows the practitioners, the providers, to then be closely monitoring what the people are doing, what our patients are actually doing, either at home, more importantly, or occasionally if they're in an in-clinic setting. Now, at the end of the day, the ability for a physician, nurse practitioner, physical therapist to instruct the patients almost in a real-time basis becomes an incredible strength of this entire program, as well as the wearable devices that we've been talking about at this point in time. And it really enables you to continue to evaluate how your patients are doing and to give your patients, whether it's a gentle nudge or a attaboy or a good girl type of encouragement, for doing what they're supposed to be doing, I think is immeasurable. And any program that we have that has a 46% success rate doing just physical activity has everything going for it and none of the negatives of other interventions. Next slide. So, Johnny, I think I'm going to turn this over to you and let you talk about how do they get the remote physiologic or patient monitoring into their practices.
Excellent. Thank you, Dr. Handel. So as we move into this discussion about remote patient monitoring, as I said, this is a program that's set forth by Medicare that actually started in late 2019. So this was before COVID, from which what they did was they actually, the idea is to keep our seniors out of the hospital because bad things happen in the hospital. Keep them engaged, keep them independent as long as possible, and you as providers can help with that. But it doesn't work unless they can compensate you for your efforts to make sure that your patients are taken care of and taken care of well. And so for it to work, they meaning Medicare, created a series of codes, and I'll show you some of these codes, but they're the 99,000 series codes that allow you to manage that patient, or you can even designate a person, in your office that can do this. It could be an MA for that matter to actually do some of the engagements, and it can be managed by you, or if you work for, if you're in private practice, or if you work for a doctor, still can be managed by you in support of the practice. So with RPM, there is reimbursement for the device. There is reimbursement for your time. And then, of course, like I mentioned, though, the delegation of documentation is important. And we actually do some of that documentation for you. We send out, aside from the dashboards that you see to manage your patient on a daily basis, if that's what you want to do, you have those reports. If you don't, and you'd rather see a weekly snapshot, we also send a week-to-week comparison of compliance, gait, and of course, force distribution. So you can see that in just a week-to-week snapshot how they're doing, probably with the importance on compliance. And then we do a month-to-month roll-up as well. And those are the reports that you or an MA, like I said, in your practice can actually engage the patient for the reimbursements that are available through the RPM program. The codes are all funded by CMS, and they are effective as of January 2020. So a little bit more about remote physiological monitoring or remote patient monitoring. It's used synonymously. So as I said, there are monthly billable codes for the engagement of the patient for your time with that patient. Now, aside from the 99,000 codes for RPM, we're going to talk about G codes as well. CMS, however, requires an annual consent from the patient because they may be on these technologies and you want them to be, indefinitely, so you can continue to work with them and keep them strong and active and healthy. As stated earlier, one of the absolute musts for RPM is they have to measure weight, blood pressure, or pulse oximetry. And as I stated, we put pulse ox in our devices, so you'll know the heart rate and oxygen saturation. Again, as I stated, anyone in the office that is designated as clinical staff can help with compiling the information and actually engaging the patient, okay? So let's get to what's real important here, because I know you want to take care of your patients, but how do you get compensated when taking care of your patients? These two codes are very important here. The 99453s, you can see that's the initial setup using the technology. And by the way, we're here to help you with that through our 800 number. We help patients quite routinely, but there's a roughly, again, $20 up or minus, depending on your geography, reimbursement for that setup. And then the 99454, which is also, that is billed monthly, that pays for the device because the device is billed through you to Medicare, from us through you to Medicare on a monthly basis, so that Medicare pays for this device over the course of time. We carry the note on that, if you will. There's no out-of-pocket cost to you as the provider, nor is there any out-of-pocket cost to your patients, which is important. Now you're giving them a device that they can stay healthy, that you can monitor them, and that device also has, well, one of them, the MyNotifi RX, also has the added benefit of fall detection. And that fall detection device does not have a monthly monitoring fee or anything like other products on the market. So your patients can have the MyNotifi device with fall detection benefit absolutely free of charge through that code 99454. Now, for your time and services, there's important codes. There's actually 99456, 57, and 58. And it's just, as you see here, for the treatment and services of that patient of 20 minutes. And then additional 20 minutes, you have to have 57 to qualify for 58. And that's roughly between $90 to $95 reimbursement on a monthly basis. And the 99456 on there puts it just a little over the $100, and it's the initial engagement on the monthly basis. And these engagements, again, it's RPM, so you're doing this remotely. And again, it could be an MA or whomever you designate to engage that patient to ensure that they're doing what you have asked them to do. And you will have all the data from which to make the clinical judgment. Now, as I stated, the 99,000 codes are not all that's available. These G codes, you may be aware of them already, but 6.1, 6.2, and 6.3, they're time-bound assessments with your patients. You see 5 to 10 minutes, in a 7-day period, the reimbursement's roughly $12. 11 to 20 minutes, roughly $22. And of course, the last one for 20 minutes or more, it's $34. Now, you may have your MA call them one day, and they're talking one day, and they may talk again that week. It's cumulative, but these codes here can be submitted each week. And so if you talk to a patient, say for 20 minutes per week, literally you're billing somewhere between $30 and $35 on a reimbursement on a weekly basis, as long as you're taking care of that patient. So here's what it looks like on an annualized dollar amount to a practice. So assuming and this comes straight from Medicare, by the way, and the attorneys that helped develop the program, call it the revenue calculator. On an average of the potential of 200 patients, and that's that they think of a practice like yours, you're seeing lots of patients. You have so many that may be a benefit to this type of technology and to your long-term care. They're assuming the average practice will have about 200 patients. You look at the coding here, the 99453, 454, 57, and 58 are actually collected in there. That's where you can see the amount that could actually be realized as a gross revenue enhancer to the practice. Now, as I stated earlier here, the device is paid for by this code. So the device, this number will be reduced, and then you would get your net. Now, will not be reduced by $153,000 by any stretch, but it will be reduced by the monthly fee to pay for the device. But once the device is paid for, that 99454 code, and it's for the use of that device, that money remains in your bank account, not MedHab's bank account, as long as you're taking care of that patient. So putting it all together, it's really pretty simple. I mean, the initial setup is key, and there'd be a phone call to MedHab. Our technicians would help you set up your account. Requires your NPI, because we actually check with CMS to make sure anybody using this technology and participating in the Medicare RPM program is of good standing with CMS. So we send it out, it comes back and all's good. The account's ready to be activated and move forward. It's a simple registration process. Literally, it takes about 5 or 10 minutes on the phone, and that's followed by the opening of a portal where there are vignettes for you to see how to read the dashboards, how to set protocols, how to set up patients. It's all very easy. Most of these functions literally take just a few minutes. And as you develop different protocols, you can save those protocols. So as you move forward, you're just clicking a protocol. You don't even have to put a new protocol back in. But what it'll help you do is obtain baseline functional data of your patients. You'll have the document, the result of that intervention and data to back that up, for your own purposes in-house and for patient engagements as well for the reimbursements. But really important here, as Dr. Handel has mentioned, is the ability to follow up long-term with your patients and keep them healthy and engaged and really hopefully out of the hospital.
Johnny, may I jump in for just a moment, please?
Yes, I'll back it up. There you go.
And actually, I'll tell you what, the next slide was going to talk to what I was just getting ready to mention.
Okay.
One other thing that's so important is as we move forward into this relatively new era, new way of providing care, the documentation of what's being done is going to be critical. I have spent enough time both with the insurance carriers as well as with the Medicare people to understand that they are quite worried about the potential for fraud and abuse in a situation like this. And the documentation becomes essential. If you document what you're doing, if your decision-making reflects the complexity of the care you're rendering, everything is fine. But if Medicare or the carriers develop or can review the records and get a sense that somebody in the office was just chit-chatting with Mrs. Tilly and not really doing anything for her care and billing for that activity, I can promise you it will be looked at, and I guess the best word is askance. So documentation is critical. I think the potential to do so much good for our patients needs to be entertained, documented, and that will allow us to use this great technology moving forward. Now, in addition to that, your office staff needs to figure out how do they get in touch with, after they've seen something, how do they let you know something's going on with the patient that you need to be involved in. And the sense is, as you begin to get involved with the technology, you will develop the protocols that you need to use to be sure that the appropriate care is being rendered to the appropriate patient in the appropriate place. And that the modalities available that enable you to strengthen and enhance what you're doing, includes all of the devices, as well as the ability to get involved with that video conferencing that we're talking about. And the critical thing, and I've made this comment earlier in the presentation, you can look at this information, real time and see what's going on, not pick up on something that occurred a week ago. And if you had known about it at the time, a more appropriate intervention could have been utilized. Next slide.
Thank you. Okay, I'll take it from here again.
You've got it again.
So when you look at MyNotifi RX and Steprite, I'll start on the left column. The price point for MyNotifi RX is $434. We're actually working on a HCPCS code right now, and we hope to achieve that, because then the device can be moved out of the RPM platform and through the HCPCS code, just pay for it up front, and you don't have to worry about it. It's clean and easy. But until that time, and regardless of the point, it's paid for by Medicare on a monthly basis. And again, like mentioned, it has a pulse oximeter that goes with it. So to pay for the device, MedHab will invoice you as the provider, at the end of 30 days, not when the device is ordered and sent out, but at the end of 30 days, which gives you the opportunity to see the patient, engage the patient, and submit your bill for the code 99454 and for the device, as well as your service codes for reimbursement. And so therefore, it doesn't affect your cash flow within your office either. And we bill that amount until the device is paid for. In this case, 7 months, the device is paid for. There is a fee for the use of this technology that is borne on the provider, which is only $10 a month, because we have to maintain the system, make sure all these reports are there for you, get them to you in a timely manner, support your staff if they have any questions regarding the reports, or yourself for that matter. So there is a $10 fee per patient per month, which is nominal given the fact that you can earn upwards of $150 per month. So our research with speaking with many providers, they thought that was fair and reasonable. So on a monthly basis, you would expect, until the device is paid for, an invoice from us for $70. However, you are making above and beyond this now. You are still making that $100 to $150, depending on how much you do with RPM. So this does not impact your services that you provide to the patient. These are specific codes for the devices. So your margin is approximately $150 per patient, or about $100 or $1,800 annually per patient. Not a bad gig. And it's what Medicare wants you to do. On top of that, with MyNotifi RX, they have a wonderful fall detection device that they can use and keep engaged with their family when they're living at home. For Steprite, it's a little bit more, it's an expensive product because the microprocessor in that is not a toy. It's like a smartphone microprocessor, because it has to handle loads of information, capturing all this information on gait analysis, because everything has to be sped up so much to capture that. So we had a much more microprocessing opportunity there, but the same platform applies. As you can see, we just invoice that amount until the device is paid for. And again, it's in the rears is the best way I can say it. So you should have your Medicare reimbursement before our invoice hits your office. And again, it does not disrupt your cash flow, nor does it disrupt the bottom line here, the $150 per patient that you can make, or the $1,800 annually. So it's really one of those things. Like I said, we tote the note on that, and we will continue to tote the note on that until such time we get our HCPCS code, and we will then advise you of that when that occurs. So closing remarks, how to get started. I mean, if you're interested, we would love to help you with all of your patients. The number to call is 800-541-1420. One of our technicians will be assigned to you from that point forward as your personal representative. And they will be the ones that take care of you, get you all set up and ready to go. Literally, that first engagement with us is about a 15-minute call or less, depending on how many questions. Once the account's open, a portal is opened up for you, and all the little 2 and 3 little minute vignettes on how to navigate the system, set protocols, it's there for you to learn. And you can always call that 800 number, and you will always get support from us at no cost. That's one of the things that we want to do for you. Again, like we mentioned, it's important, if you're not taking care of this, even though you're controlling of it, you designate the office staff that will help you with the engagements of the patients and helping you with some of the documentation. Keep in mind that all the electronic documentation, all the data collected from our devices are there resident on the cloud, on a HIPAA secured cloud for you to take at any given time. You can look that up, and it's there. And if you need help, we can help you with it. And again, we roll up the reports and send the weekly comparators and the monthly comparators to you as we just said, weekly or monthly basis. So if you have any questions, in general about this, since this is a taped recording, you could visit the website at www.medhab.com and communicate through that. I encourage you to go there and click on the 2 products and learn a little bit more. But you can also reach us at support@medhab.com with any questions that you have, and we will get back with you promptly. With that said, I want to turn it over to Dr. Handel for closing remarks, obviously because we can't answer questions on the recording.
Thank you so much, Johnny. Yep. This is technology that is here today that truly has the capacity to improve the quality of care, the outcomes for our patients, and ultimately their quality of life. And I think it's wonderful how, unfortunately, COVID-19 has pushed us rapidly to this point, but it's fortuitous that the technology is coming together and the pieces fit beautifully for patient care. Johnny, thank you very much for letting me participate.
Excellent. Well, in close, I thank all of you, or thank you for being on the call. And again, if we can help you in any way, please feel free. Here's how you can engage us. We might reach out to you as well, but we won't be over the top. We'll reach out just to thank you for your time and help you with any questions that you might have. With that, this concludes our webinar. Thank you very much.